Well, look, economics, if we are talking about finance, is a science of economic agents that work in their self-interest without talking too much to each other and developing this highly sophisticated, complex behavior. I mean, if I change a few words here, this doesn't look a lot different from biology. So to me, this is an indication that the diffusion of tools from one field to the other will work very well. We see it already with aging. Like we have started applying essentially non-equilibrium statistical mechanics to aging organisms, and we put forward a bunch of predictions a few years ago, like drugs that work well in mice would not work so much in humans and will have their effects disappearing once the treatment is stopped, for example. And that's exactly what people now see in clinical trials. We are now telling that there will be drugs that we measured maximum human lifespan from biomedical measurements for the first time. And we now see that there will be drugs, the drugs are coming that will bring average lifespan to maximum lifespan.
Dr. Peter Fedichev is a distinguished physicist and biophysicist renowned for his pioneering work in aging research and drug discovery. He earned his PhD from the University of Amsterdam. Throughout his career, Fedichev has published over 70 scientific papers spanning physics, biophysics, and aging biology. As the co-founder and CEO of Gero, an AI-driven biotechnology company, he has been instrumental in advancing the understanding of aging mechanisms and developing potential therapeutic interventions. The company has also established a collaboration with Pfizer to leverage their insights into human aging for drug development. Fedichev's unique approach integrates principles from physics to unravel the complexities of biological aging, positioning him as a leading figure in the quest to extend human lifespan. May I call you Peter?
Yes, please.
All right, Peter, that's a very impressive, and we are extremely honored to have you on our podcast today.
Well, thank you very much for having me.
So you're in the States now?
Well, now I'm in Switzerland. I've met
Switzerland.
another pharma company a few days ago, so part of my work.
Okay. So we want to congratulate you. You had a narrow victory in the 2024 competition, the prize organized by Open Longevity, where you debated in a friendly debate Aubrey de Grey.
Well, this is true, and indeed the win was quite narrow, but I think the discussion was super cool.
The point was, of course, to bring attention also to the field, obviously.
Yes, exactly, and also to things that we can realistically expect.
So to start on the kind of big overview questions, biophysics and gerophysics, usually we think of the disciplines as we got the special discipline like biology, and of course it happens inside the world of physics, but very often people in biology, they're in biology, and people in physics, they're in physics. So I wonder if you could talk a little bit about those levels.
I think it's highly debatable philosophical question. So obviously nature is not organized by the way we organize departments of our universities. So nature is organized probably by scales. Obviously everything is physics, but already on the level of chemistry we have chemists because you cannot reverse engineer chemistry or build chemistry from ground up. We don't have computational capacity to actually do that. And at the next scale, at the scale of molecules, we have a new discipline. And of course, when molecules start talking to each other, we get molecular biology, and then suddenly we have medicine, and God knows what do we have next? Maybe psychology, maybe economics, right? So we have all these kind of scales. So historically, people had to figure out how things work at different scales before waiting physicists to figure out how different scales are organized. So that's why at every scale we have specialists. So they developed their specific set of notions, theories, models, and everything else. And what I think physics was successful in the 20th century very much is that physics was trying to go in scales from bottom up and trying to see how new concepts emerge. So this is the whole, I mean, people discuss quantum mechanics as revolutions in 20th century physics. People discuss relativity theory. It's not like everyone understands, but at least in public perception, we have some mental models for that. What I think is somewhat missing is that in physics in 20th century, there was another revolution. It's like Phil Anderson's paper, More is Different, when physicists started thinking how, once you move up the scale, most of the things become irrelevant and few other concepts appear. So every scale requires its different model of thinking, and there are ways how to develop those models of thinking and how to apply them in a quantitative way. So that's where I think the power of physics will eventually come to biology, because we need to understand what is relevant, what is not. We don't need to know every minute detail of operation of living organisms to understand health and disease. We have to apply things like statistical mechanics to understand those, because these are highly complex systems. And definitely new notions should appear, both in physics and biology, in order to describe that. And well, I think every century physics, it's another scale of matter organization. And I think 21st century will be the century of biology and physics.
Okay, but I guess one of the difficulties here is it takes some energy to become proficient in physics, but also then to know biology enough, perhaps. How did you arrive at that combination of skills?
I hope that I'm not a bad physicist. Well, if you look at what physicists are dealing with over the last, let's say, 20, 30 years, you would see that, what are the hot topics there? Quantum computing, string theory. So, that's the beginning of 21st century. And now, 20 years past, string theory is most probably dead. Quantum computer maybe still doesn't exist, which means that physicists are now in this kind of precarious limbo right now. So we have tools, but physics itself does not provide systems. Like physics is kind of understood too well. So that's why I think we have now diffusion of people, like physicists are going into finance, for example, with a few exceptional examples. So I believe that physicists will diffuse in biology as well. And of course, biology is an established field. So we should not be thinking like, physicists have some unfair advantage and biologists do not know what they're doing. In fact, they do. Look at the drugs that they're developing. This is really a very efficient field. But I think most of the progress always comes at the boundaries between scientists. So I think that fostering multidisciplinary collaborations where you have biologists who see the value of what you are doing and asking them for advice or helping them to figure out what they see together, I think together provides a competitive edge. Because what physics brings is this idea that most of the information about complex systems is irrelevant, so you don't need to overstudy. And physics works with numbers, meaning that if a physicist tells you that we can extend life by such and such, it means that within an order of magnitude, there is an estimate for how much. And I think this is very important.
It's the mathematics, of course, that makes it possible for people in physics to go into finance. But you say it's also important. It's a mathematical core that's also very important, and statistical analysis that's also very important for the field of biology, and where your perspective can bring something to that dimension.
Well, look, economics, if we're talking about finance, is a science of economic agents that work in their self-interest without talking too much to each other and developing this highly sophisticated, complex behavior. If I change a few words here, this doesn't look a lot different from biology. So to me, this is an indication that the diffusion of tools from one field to the other will work very well. We see it already with aging. Like we have started applying essentially non-equilibrium statistical mechanics to aging organisms, and we put forward a bunch of predictions a few years ago, like drugs that work well in mice would not work so much in humans and will have their effects disappearing once the treatment is stopped, for example. And that's exactly what people now see in clinical trials. We are now telling that there will be drugs that we measured maximum human lifespan from biomedical measurements for the first time. And we now see that there will be drugs, the drugs are coming that will bring average lifespan to maximum lifespan, which is plus 40, plus 50 years of life. but the mathematics tells you that these drugs will not intercept function decline. So that's a horrible, example. We will be living longer, but not too well. And of course, there will be drugs that will extend maximum lifespan. And that's where I think the power of mathematics and statistical mechanics coming in. We don't only hunt for right sign of the effect. I mean, that's cool, but I mean, roughly, in a cynical way, half of the interventions extend life and half of the interventions reduce life. I mean, it's just a matter of the effect size. What's important is that when you start applying these things to the data, because physics is also a science about data, right? I mean, physics is not a language processing machine. Physics is a science about quantification of measurements. So once we once we apply such tools to biomedical data, when we combine this with machine learning and artificial intelligence, we start seeing things like biology that is responsible separately for average lifespan, maximum lifespan, and that gives you immediately options what you would expect and what kind of drugs would you create. And I mean, even if we are wrong, having a bad theory is better than having no theory at all, because if you can refute a bad theory, you will end up with a better theory. So maybe to give you, because I think I see where you are coming with this kind of with these kind of questions. I think that quantitative description of complex systems is really a very powerful feature of physics models. These physics models have to be fed with the data, and we have the data. The data is highly complex, but we have AI. So I think now it's just the right time to make sure that we understand what we are doing by looking at the data, and then we will end up with better drugs against not only disease, but aging as well.
I mean, physics is similar to philosophy in the sense that we try to kind of step back from the complexity and the manifold and the ever-changing small stuff and say, what are the general principles behind this? And we're trying to find what are the most basic patterns that we recognize.
Exactly. Look at what we're doing in drug discovery. So especially in experiments against aging. We take mechanisms or molecules and we test them in worms and mice, and we hope that they would work in humans. And if I look at whatever pathway that is involved in the action of a drug, it may have 30% less genes in C. elegans in worms, and still the drug would work, which to me tells you that biology is exceptionally robust. I mean, that's good and bad. That means that most of the interventions that you are developing will not work, right? Because the system will adapt. Biology is highly adaptable. And that's why when you try, if you think what you do with drug discovery, that's very strange, because you want to change behavior of the whole organism, right? On a large scale, like me aging on a time scale of 100 years. By inserting a molecule into my body that will interact on a time scale of microseconds with my proteins. So think about it. So how much this time will have to adapt to the interventions that I provided. So which means that most of the interventions will not work. The ability of these systems to adapt and self-average, the average out the effects of our interventions is exceptional. That's why almost nothing works in clinical trials, by the way, even though everything works in vitro, for example. So that's why I think what physics can bring to biology is this idea that if you intervene at one scale and expect the action on the other scale, there is a challenge. Very few things propagate from one scale to the other, and physics has some tools to understand which things propagate from the micro scale to the macro scale. And that's exactly, unfortunately, what drug discovery is doing. We are looking for microscopic interventions against microscopic things. And to my taste, I think this knowledge has not yet propagated from physics to other fields. And biology is a great tool to study and understand this.
Well, there's a lot of things going on that's new in the way that we focus on different aspects of biology. For example, now Geroscience, as we call it, is the focusing on just the aging aspect, and there's much more attention to that. And before, of course, physics has been applied to other fields of biology, and now we say, okay, let's apply both the power of the physical thinking and biology towards the gerontology, right? So
yes,
there is a
logic. Yeah. There is a logic to that, because from our previous conversation, it's kind of clear that Physics is powerful when many small things interact together, average each other's effect, and something new is emerging. So you would expect that physics will be applied to medicine better for the processes that are the slowest ones, like chronic diseases and aging, right? That's exactly. I mean, if you have an acute condition like influenza, and no problem to study it in a 3 days experiment in a petri dish and in 1 week experiment in mice. You don't need physics or machine learning to understand that. I mean, with infinite resources, you could just screen infinite number of molecules and get something that will work and be not toxic. When this thing fails is exactly the situation when a disease takes tens of years to develop. And then suddenly you don't have standard biological tools to even study it. I mean, how? Like, you can kill a mouse on a high-fat diet in 5 weeks, literally kill. And humans can go to McDonald's for 50 years, I mean, with some body shape variation, but humans are a lot more robust. So tell me, how would you study the onset of obesity in humans if your model cannot survive McDonald's food for 5 weeks? So there exactly where I believe physics is important. So of course, biology is ultra efficient if we study fast processes. If we study how a molecule binds to a protein, I know we have wonderful charts, very accurate measurements. If we study response to virus or bacteria and on time scale of days, we are super efficient. We can screen, we can do whatever you want. But what is the chance that if your molecule reduces a marker of a certain disease on a 3 day time scale, that would still work on a 30 years time scale in humans? And that's exactly the questions which the physics of complex systems is asking. Basically, the question if the effect that you measure on the micro scale propagates to the macro scale, and what are the expectations there? And I don't think that this is very well understood.
So you have a tentative theory of two paths or two processes that's going on here. And one of them is slower, linear, and the other one is more dynamic. And this is something that explains the difference between the mice and
Yeah, a
the
lot
human.
what we see.
And could you
Yeah,
go into and
sure.
describe those in more
Yeah,
detail?
yeah, that's very simple. I think we have like three phases here now on the podcast, and if we think about phases of people we know across our lifespan, we understand that faces change over time. I mean, that's aging, and obviously there are two kinds of features that are changing as we age. The size of my nose, the size of my ears is unfortunately going up just one way. I mean, the longer I live, the larger would be my nose and the larger would be my ears. But on top of that, there are features that basically distinguish me tired from me relaxed. And normally, when you are sick, you look tired, or you look older when you are sick and tired. But if you are not sick anymore, or if you slept over enough, those features get back to the norm. So already this simple example is telling you that there are two kinds of aging process in humans. There are some kind of very slow and progressively going one way processes, like the size of my nose. And there are reversible things that are going up and down depending on my personal life history of stresses that I'm encountering. So this slow linear process appears to be irreversible. I mean, there is no amount of sleep that will make my nose smaller. And these dynamic processes are reversible. And by some historical reasons, we humans are very strong and reversing this kind of dynamic reversible features. And that's what most of our drugs against aging do right now. But also, if you compare the effect, how faces changed with aging by the progressively linear features of those reversible, you would see that progressively linear features are a lot more powerful. So which means that the drugs that affect these reversible dynamic features, they will work. I mean, obviously, if you sleep better and if you quit smoking, you live longer. But the effect size is very small. I mean, even the effect of smoking, I'm most probably even not allowed to tell that. But I mean, that's a lot, right? 5 to 7 years. The effect of smoking is huge. But if you compare it with 70 years of lifespan that we have right now, I mean, even with smoking, which is actually a taboo word in kind of medicine, right? But even with smoking, you cannot kill yourself very much because these irreversible linear processes, they're very robust. They just don't care what you do, good or bad.
Peter, can I ask you, this might be a stupid question, but if we're going to continue with the analogy about noses, you could do plastic surgery on your nose.
Yeah. The problem is that it's not only your nose that is changing progressively linear with time, and most probably the effect of your enlarged nose on health is not very large, which means that unfortunately there is a lot more linear damage that is accumulated everywhere else, and the nose part is not just is not just important.
Yeah, I was going for, I mean, your debate with Aubrey. I mean, Aubrey de Grey is, of course, promoting the damage repair approach, and you don't see completely eye to eye there. So, what would you say are your main point of argument here?
Exactly. Well, thank you for this question because that's exactly, I think, a part of physics that did not diffuse very well in the public discourse. So especially with all these books on nanotechnology and omnipotence of modern biotech, we're having this idea that we can go in on a molecular scale and do whatever we want. There is a good analogy which is playing right now on the internet, which is now used in a better way that we used. So, can we unboil the egg without feeding the chicken, feeding it to the chicken? I mean, that's an engineering problem, right? I mean, there's nothing that is not covered by chemistry and physics involved in boiling egg. So in principle, with an army of nanorobots, in theory at least, we can go to the boiled egg and totally unboil it. But what people don't think about is that what is this energy cost? Even the energy cost is nothing, right? But the problem is that you have to have a lot of control to do that. You have to see precisely what happened in that place, not in the other place. Come there with things that will revert the bad thing in that place, but without touching other things. So essentially, you have a highly stochastic trajectory that led to the boiled egg, and then you will have to undone it. And it's not even, I mean, of course, people attack me and saying that the energy required to do that is small, and that's true. But the problem is that in complex systems, having lots of constituents, you have to have unreasonable amount of microscopic control to do that. It's not like it's totally impossible. But all our experience with the second law of thermodynamics basically tells you that different things, I mean, everything is reversible, no problem. I mean, our laws of physics are reversible on fundamental level. The problem is that some systems are built in such a way that reversing them requires so much control that, let me carefully put it in this way. So when I'm saying that most of human aging is not reversible, I'm saying that unfortunately human aging is in that category. Which means that I don't want to argue because predicting future is hard. Of course, maybe I don't know. Maybe in the future there will be ways to undo all this microscopic damage at infinite level of precision. But it's very easy to do predictions in biotechnology, unfortunately, because from ground up to registered drug it takes 7 to 10 years. So unfortunately, I can tell you what will happen in 10 years. I mean, you can kill me for that, but that's the harsh reality, which means that what I'm trying to tell is that unfortunately human aging is entropic, meaning that it is built from uncorrelated damage events across your body that each other have no information about all the others. I mean, knowing one, measuring, diagnosing one doesn't give you any information about all the other ones. So essentially you have to disassemble the whole body and reassemble. Let's put it carefully. So if we're thinking about biotechnology of aging in 15 years, like 2 times drug discovery time, I believe that stopping aging, so reducing the rate of aging, is totally possible if we focus on that. I mean, we will in 15 years we'll have 2 attempts to that. I mean, this is super reasonable time. And what the physics intuition is saying that going against second law of thermodynamics is a very harsh proposition. So what we are trying to tell here is, well, many people think that what we are telling about what we are reporting in a negative sense. I'm trying to spin it positively because You only go to Congress and ask money for a nuclear bomb when you have an estimate for costs within an order of magnitude, right? All projects overspent, but I mean, it's not like 3 orders of magnitude. So what I'm telling to everyone is that with the level of control that we have now, I mean, with kinds of drugs that we can develop and with kinds of data that we can look at, we can easily, I mean, some people are a lot better drug discoverers than I. So I think it's super technically possible to reduce the rate of aging, maybe to make humans non-aging, and that will be already a lot. I mean, that will give so much life that predicting technology on that scale, it's not even reasonable, right? I don't even know what kind of technologies will show up. And I predict that most of the projects that will that focus on the reversing aging without understanding the level of control that they need. I mean, every century brave people are trying to approach second law, and it's very hard. So what I'm saying is that let's focus on interventions that reduce the rate of aging, that will have immense humanitarian and commercial impact. And then let's see if somebody proves that I'm wrong, then, future is bright.
So would it be correct to say, to continue your analogy that I liked very much with the egg, that you are saying if we want to do something groundbreaking, we had to turn down the heat so that we boil slower?
Put the ice in the water, and you will have it going a lot slower. And we are talking about classical systems here, so there are no traps there. So classical physics is understood well. So when you start thinking about aging as an entropy production, you understand that having entropy production reduced is super possible. You immediately start looking at things that are markers of the entropy production in these systems. And these are, by the way, macroscopic things, right? So you're not looking for a particular pathway, for example, that tries to do something special. You're looking for pathways that affect a lot of other pathways at the same time. So that's exactly the ideology coming from statistical mechanics. So if you want to affect the system on a large scale, you have to be looking for biology that affects the system on the large scale. And most biology is local. So, I mean, you have, once you believe, once you buy in this picture, which is because in biology there is this inflation of theories, right? In physics there is a standard model, I think, that does not explain only, I don't know, 2 experiments at the accuracy of 1/1,000,000. But this is not a theory because this is standard model, and we know that this is totally wrong. In biology, you have hundreds, maybe 100 theories of aging, and that's why nobody cares about building up another theory of aging. What I'm saying is that we need to have a theory of aging. Because if we have the theory of aging, then we understand what is what are terms in which aging is described, which of those terms are affected by different kinds of interventions, and then we can immediately understand what we need to do in order to have larger, stronger effects. I think we need to bring back to biology of aging the idea of having bad theory better than not having it all. And I think it's super important.
When is it too late to put the ice in the egg, so to speak? When is it too late for an intervention? When has the damage accumulated so much that you can't really possibly intervene in any meaningful way? Can you say something about that?
Yes. So, for example, we didn't publish it, but you can ask yourself this kind of question. So, for example, you can go to medical data and see for how long people stay in hospitals, right? We presume that modern hospitals are expensive. Nobody is staying there for fun. So probably if people are staying there longer, probably doctors have good ways of thinking that it's not they're not allowed to let this guy out, right? So basically, the hospital stay is a measure of your resilience. It's a very inhuman way of measuring your resilience, but fortunately or unfortunately, we have lots of this data. And what we see is that the hospital stay is increasing as we are getting older, and it is increasing faster than linear. Actually, it tries to, by interpolation, it tries to become infinite at 120 years old, which means that, this is the effect of aging. So now you can ask yourself, are there categories of people where this hospital stay is even longer? And we know that. So people with diabetes type 2, for example, they are dying from COVID with a lot larger probability, with a lot more probability. So you can see that the effect of one disease like diabetes type 2 actually takes out about 10 years of maximum available, of maximum lifespan, which means that when people are reasonably healthy, meaning that they don't have any of those debilitating diseases, then of course this ice is their bigger problem, right? Because they want to stay cool and to live longer before one of those diseases strikes. Once one of those diseases strikes, the diseases start eating up their lifespan a lot faster than the damage. So that's why, doctors are no fools, right? So doctors, I think medicine is for hundreds of years in the business of extending human life, right? I mean, that's what they do, even for selfish reasons. That doesn't matter. I mean, as a system, it works to extend human life. And what these people understood is that by drugs that work against symptoms of diseases, you can extend life past the emergence of diseases, and that's what we are increasingly better at right now. The problem is that there is other, I mean, and these diseases can be considered as a form of damage, right? I mean, this is kind of an earthquake in your body, so that the body goes into a totally different phase, essentially. But unfortunately, there is a lot more damage that cannot be even diagnosed. And it's so different in different cells and everywhere that there will be no way to develop a biomarker and a drug against each of them. I mean, if we just think about normally if somebody is telling that to solve a problem we need to develop 100 drugs, I mean, that already is suspicious to me. So that's why I think that of course we still should focus on diseases, and our drugs against hallmarks of aging will be good drugs against specific diseases. No doubts about that. But in humans, they do not affect this entropic aging. We published a preprint about that recently, and we have seen a few examples over the last year, meaning that there is something else, this dark matter of damage, that is too diverse to ascribe ICD-10 codes to that. And that dark matter awaits for statistical mechanics approach. We cannot study each of such events and, get up biomarkers and drugs. This is not realistic. We should be looking for biology that controls them altogether and try to come out with drugs that will be helping people a lot earlier than a typical disease.
So when Aubrey says that we have known for a while that there are just a handful of ways that things go wrong, and we just need to address those, what exactly is your worry here?
Worrying that yes, in some broad terms, there are very few kinds of damage that accumulate every age. The problem is as I said, in control. We are coming with drugs that universally penetrate our body. I mean, most of the time, right? So they hit all the cells at the same time, including cells that have a specific sort of damage and cells that do not have a specific sort of damage. So our drugs do not come with a tiny robot each that would go into the cell and check if this particular cell is damaged or not. Basically, to revert a lot of damage, you have to come in with very strong drugs, and those drugs, once they start touching healthy cells, they will generate damage on their own. And that's what we can see, for example, with Yamanaka factor rejuvenation in mice. The guys did dose escalation there. So they were activating these factors for longer and longer periods of time. And we could see that in kind of linear regime, when the effect is small, the effect was beneficial, no doubt about that. But very quickly, they maxed out. And even better doses, unfortunately, reduced the lifespans of the animals. Meaning that to produce strong effect, you come with strong interventions, and then if you're lacking control, I mean, when you come with strong interventions without sufficient level of control, you start doing more harm than help. We need some new, I mean, to fight second law thermodynamics, you need some kind of a revolution in biotech that will suddenly learn how to differentially affect cells with different I mean, it's not something that, remember this, my prediction that in 10 years you will have only things that already work in the lab. So it's not it's not like it's totally important, but I mean, even 15 years, 10 to 15 years is a long time for many people. And what I'm warning is that, I mean, people understood second law of thermodynamics in a hard way. Boltzmann hung himself trying to convince scientific community that out of reversible microscopic laws, we can generate a reversible microscopic behavior. And then he didn't live just a few years before his results got appreciated. I think that still biology and especially biotech is a kind of this, kind of rosy planet where their efficiency of the microscopic control that they have technologically now makes them think that they can do whatever they want. But if you try to do kind of very precise surgery on a living organisms that tries to do something else at the same time without, cooling it, disassembling, fixing things, I'm just telling, not in 10 years, not in 15 years. And if we are talking about resources, I mean, if we are on the side of humanity that believes that aging can be stopped, my guess is that putting your dollar into reducing the rate of aging is totally possible. And by the way, there are mammals that do not age. So I can even show that this exists in nature.
Yeah, let's talk about the naked mole rat now, since you brought it up. What is happening there?
Well, there is, as always, a factual side and interpretation side. So I like to spin this story in the following way. So humans are probably interested in aging for, 10,000 years. And in late 20th century, the suspicion started growing that there are animals that do not age or age in a very slow way. When I was a schoolboy, I knew about that, but I didn't care because humans are apex of creation, so why should I care about some kind of mollusks? But it appeared that naked mole rats, in naked mole rats, you could not measure what is called mortality acceleration. So in humans, our chances to die of all causes, even by accident, to being run over by a bus at sufficient age, go up exponentially and double every 8 years. This is aging in humans. Naked mole rats, you cannot measure the increase of mortality over time, over 30 years. And these guys are not larger than mice. And biology is kind of very simple. The larger you are, the longer you live. I mean, with kind of with exceptions, but I mean that was already very strange. There are bats. I'm only talking about mammals here, by the way. There are bats, and it turns out that most bats are exceptionally long-lived, and we don't even know. So think they work suggesting that naked mole rat doesn't have measurable what is called demographic mortality acceleration. This acceleration of mortality was published in 2006. And to me, if you have a field of science where this level of discovery can be made in 2006, it tells you a little bit about the field of science, right? Because, well, to me, this is the most important discovery of well, people are saying that naked mole rats do not maintain temperature, they are almost hibernating, blah, blah, blah. But when I see bats that fly, I don't believe in this kind of metabolic insult theory, right? Because if you are a mammal and you want to fly, I don't believe that you are metabolically compromised anywhere. So we have clear examples where you can be totally uncompromised metabolically and still live a long time. Now, we don't know for how long these animals live, if there is measurable demographic mortality acceleration there, because if you start working on this in 2000, and if these guys live for 40 years, you don't have them in the lab. So we're in limbo here. Whether they age, meaning that there is some slow rate of aging or there is no rate of aging. I mean, I'm talking about factual side here, right? Because patients are dangerous. So if this discovery, and by the way, this discovery was done by grant money from Calicut. So this otherwise totally uninteresting discovery in the field of aging biology could not be funded in a normal way. You have to build a company for hundreds of billions of dollars, set up Calicut and fund this experiment, which I think was less than $500,000 in spending. So to me, this tells you that field of aging is still very young in some ways. No disrespect to anyone, but I think this example is very good. Because if only what matters is the difference between lifespan between naked mole and mice, I really want to have this amplification factor on my lifespan. And that's why I think we should be studying this example and If you want, I can dwell into that. But really, when people asked Congress to give money for nuclear bomb, there was no nuclear bomb in nature. So the reliance on physics models was sufficient to them to tell that even though you haven't seen a nuclear bomb in your backyard, you can still fund it and get it with reasonable probability. What I'm trying to tell you is that in aging biology, we are fortunate enough to see that there are many animals, including our close relatives, that have exceptionally slow rate of aging. And by the way, that's entropic aging. And to me, this is, this is a wake-up call to everyone that, look, we don't need to prove that slow rate of aging is possible, right? I mean, these guys are running in our labs already. So this is possible. We don't see examples of age reversal in mammals, right? There are no adult mammals anywhere going into whatever infant stage. But we see lots of examples. And if you look at their genetics, for example, you can see that they achieved this in different ways, by the way, which is very encouraging, which means that you don't need to, to lose your fear, go under the ground, establish matriarchate, and give up on temperature regulation. Right? There are multiple paths that, and this is universality. That's exactly what physics likes, right? So this is a very interesting example. You see now situations where the same, what they call in biology, phenotype emerges by different molecular means. So phenotype is a lot more robust than particular realizations of those phenotypes, which most probably means that we will have a choice how to achieve that. And that's precisely what I'm kind of calling for. I'm saying that you will not be able to revert it. These guys slowed it down. Let's try to do at least what they have done. And I mean, these guys, some of them are even flying, so probably we may even be able to increase our metabolic output on the way to.
And if we're talking about the naked mole rats, that's like an order of magnitude longer lifespan than regular mice, right?
Yes.
So,
but that's
yeah, you go.
What even more important is that, look, if a human is 40 years old, on average, it has maybe 40 years of life right now in advanced countries. When a person is 60 years old, it has on average twice less than that. And then when a person is 100 years old, on average, these people will, most probably these people will die next year. Meaning that, in naked mole rats, it's totally different. So if this guy is alive 10 years, it still has 30 to 40 years of life. If this guy is alive 20 years, it still has 30. They're not immortal, right? We're not talking here about immortality. Just they're dying from the same diseases like we do. But those diseases are not age-dependent, which is very interesting, right? Imagine that if cancer would not be age-dependent disease.
Yeah.
It's very interesting. So it's not like solving aging in a sense, reducing the rate of aging to zero will kind of negate the medicine, right? All the diseases will be in place, and all the technologies that we have to control those diseases will still be used. The only difference is that the incidence rate of those diseases will go down. That they are still dying, so it's not like if we put them in a totally controlled environment, they will be immortal. No. So on average, they will be living 30 to 40 years. And that's it. I don't think that the level of the control on the environment is very much important. Remember my example with smoking. When we're talking about this entropic aging phenotype, once again, smoking is really bad. But once again, if you think about it.
I don't quite understand that. Like, why would the mole rat in a very good environment, safe environment, why would it not be longer living than a human if the entropic aging, according to your theory, is almost flat?
A naked mole rat has a 3% chance of death per year, which of course translates into 30 years of life. Now, the most important part is that this probability doesn't grow up with age, which is almost ridiculous on a human scale.
So basically, though, if a mole rat in the ideal circumstances, controlled circumstances, if, for example, it develops cancer and let's say we use medicine and we cure it, then it should bounce back like a 25-year-old with cancer too.
Yes, so it must have a lot better chances to survive cancer than people, because we also know that people at advanced stage have lesser chances to survive. So it's really the advantage of having age negated from your life planning here, right? So you kind of have a probability of being hit by a brick from 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 the top, but it's the same every year, and you remain useful, meaning that even if something bad strikes, you still have pretty bad chances to survive, which are independent of age. And this is a lot better world than we have right now, where the medical technologies develop, but people extend their physiological reserve at some point, and even new technologies like even knee surgery may not be possible for a person if he is too sick.
This episode of Levity is brought to you by Vitalism Foundation.
Vitalism Foundation is a non-profit with a revolutionary mission to achieve unlimited lifespans in peak health.
It's a community of action driven by vitalism, a new moral philosophy whose first tenet is that life and health are good, death is humanity's core problem, and aging its primary agent. They're one of the few groups that truly understand aging as the emergency that it is.
Vitalism's goal is nothing short of monumental: to allocate 1% of global GDP to this project. It's ambitious, but it's exactly what's needed to tackle aging head-on.
As a member of Vitalism, you'll get access to a private community, exclusive content, and invites to special conferences. Plus, you'll receive insider prices on longevity wellness services from Vitalism's mission-aligned partners.
But more than that, you will be supporting a mission that's too important to leave to others to tackle.
So, you should really join us. Follow the link in the description below. For a limited time, you get 30% off forever. Just use the promo code LEVITY at checkout.
Again, that's 30% off forever with the promo code LEVITY. Let's make a difference together. So your analogy with the boiled egg, of course, is that as long as that's going on, yes, we can patch up and fix things, but ultimately we are a boiled egg and there's no turning back. And
yes, exactly.
And I was thinking, if you could explain, you're talking about, also literally, you're talking about temperature. I was reading, you talk about the concept of effective temperature. Could you explain that to a layman?
Well, sure. Obviously, in biology, like everywhere, well, mostly in biology and medicine, we are talking about levels of certain things, like high glucose level, right? So if you have a high glucose level, you have a disease, and then somebody comes with a drug, and hopefully the glucose level is going down, and then probably the disease is under control. Maybe not cured, but at least it is controlled. Now, other than that, another important property of a system is how variable are your glucose levels and everything else, right? Because if you are resilient, if you are able to recover from stresses, then your physiological variables will stay close to the optimum norm. So the more fluctuations you have, the more the probability of rare combinations of adverse effects when all your physiological best simply by chance, when your physiological parameters by chance departed into the wrong range of parameters and you get hit on your DNA by somewhere. So essentially the better is the physiological control. The tighter your physiology is controlled, the less are the probabilities of rare adverse events that together can pile up as damage. So what we are calling for is to study not only the levels of things, because hallmarks of aging are kind of parts of this philosophy, right? We are looking at things that go up with age, and we say that, look, let's try to remove them. What we are calling for is that in long-lived animals like humans, our hallmarks of aging are under control most of our life, under very well control. So that's why drugs against hallmarks of aging do not work very well in healthy people, because you have kind of endogenous drugs against these diseases in your body. But when those systems that control these hallmarks of aging fail, then you start developing disease of aging. So the probability of failures in these systems depends on the fluctuations. And in physics, the measure of fluctuations is temperature. What we're trying to tell people is that we should be looking at fluctuations of physiological parameters. We already see that people with higher fluctuations of physiological parameters live short and a lot shorter than people that have a particular hallmark of aging up relative to the control. I can give you one example. Take any good paper on clocks, right? Because now everyone measures aging with clocks. And then there will be a table in this paper. And this table will tell you that if a biological clock exceeds your age norm by 1 standard deviation, your risk will be increased by 5%. So think about a drug that you can make that will reduce your biological clock by 1 standard deviation. I mean, that's not a small feat, right? It should be ultra safe. It does the job. But then your risk will only decrease by 5%. Which technically says that you will be living 0.5 years longer. So that tells you that in animals that are able to control the variation of key physiological parameters, like humans are, we're already long-lived species. We're complaining, but we live a lot longer than lots of mammals, right? So in animals that are able to control their hallmarks of aging, the levels of hallmarks of aging stop being important. I mean, this risk ratio of 5% is telling you that hallmarks of aging are not very important for you. So then the question is, what is important? And what we're telling people is that what is important is the fluctuation. So if for some reason you are not able to maintain the optimum physiological variables, your chances to generate adverse events that will be translated to damage will go up very quickly with temperature. And that's why, I mean, we call it temperature because this is like temperature is defined in physics. Those who remember in physics textbooks, if you have a room filled with atoms, then when they equilibrate, then on average each has the same energy. And the energy is the fluctuations because the atoms moving back and forth all the time. So it's not like the average velocity of atom is zero. So the level is not important, but the amount of work that you can do with the steam engine only depends on the temperature, which you have there, on the amount of fluctuations. So it's exactly here. Here the station is exactly the same. You have a strongly interacting system. So each of them, each of the components, pathways, hallmarks of aging, everything else is being kicked by internal and internal reasons. So they're highly stochastic. And then if you have some fluctuations fed into one of the systems by interactions, it will spread across all the other systems and they will become hotter. And then the hotter your system are, the earlier you will die. And that's what we are telling. So in animals where hallmarks of aging control lifespan, like in mice, you should go for levels of things. And when you hit with a drug that reduces a level of bad thing, you publish a Nature paper saying that you extended life by a certain number of percent. What we are trying to tell in humans is that since your hallmarks of aging are under control all the time, most of the time, if you're not very sick, you should look at fluctuations and at the biology, because this thing is in many ways like temperature. So there should be systems in your body that are telling you for how much you can be dysregulated. So there should be systems that regulate the fluctuations, right? Like you have heat shock system, right? The real temperature. You have a system in your cells that tries to measure the temperature by the amount of proteins that are denaturating, like boiling the egg. And then when the system sees that there are too many proteins to be fixed, it tries to generate more proteins to fix, to unboil the proteins, right? I mean, that's how biology tries to do that. And at the same time, it generates signals that will reduce your body temperature. So in the same way, other types of biological fluctuations should be controlled. And we at Gero are specifically looking at biology that is controlling not the levels, but that are controlling fluctuations across multiple systems at the same time. Because remember that in order to affect entropic aging, you should come with interventions that affect multiple pathways at the same time.
Controlling fluctuations.
Yes, exactly. Because if you only say that aging is, I don't know, 15 hallmarks of aging, if you seed 10 companies per hallmark of aging, then in 10 to 20 years, you must have the solution of aging. I think this program took off in 2005, roughly. And we had 5 to 10 companies per hallmark of aging funded. And quite a lot of them ended up in clinical trials. I mean, autophagy inductors, obviously. I mean, lots of other things. Even Repalox were tried, for example. But we in these clinical trials, and we had access to some clinical trials data, we don't see like exceptional results, meaning that Human biology of aging, unfortunately, is a bit too robust. Hallmarks of aging are out of control only very late in life, unfortunately associated with diseases. And there, where I believe aging biology meets medicine, because medicine has been doing diseases all this time. So good drugs against hallmarks of aging will become good drugs against chronic diseases. And for aging, you have to do something else, and that something else has to be statistical. You cannot solve it by counting another 100 hallmarks of aging and keep seeding companies against each of them.
If your theory was widely accepted and everyone started working towards a solution for aging, or at least slowing the aging process down as much as possible, how would that inform science? How would science be done? Aging biology be done? And what kind of interventions would we eventually get from that?
So, yeah, first of all, I want to bring attention to the necessity of building a theory of aging, irrespective of whether it is my theory of aging or somebody else's theory of aging. But since this is arguably one of the most important things economically, from humanitarian point of view, economically, and everything else, there is demand. There is a demand from society, increasing demand on solving this thing. And I think science has to come up with roadmaps that are based not on language processing, but on the data and some, at least modeling, right? I mean, that's how we solve problems in engineering. We're not trying to build planes that look like planes and test them in clinical trials by trying to make them fly. So before planes are built, yeah, I think it's actually a very good example, because if you think about engineering projects like airspace and biotech projects, they are on the same level of costs. I mean, to build an aerospace system and to build a drug against chronic disease, I think the amount of investments is comparable. In aerospace, you do not pitch projects without numbers. I mean, you really show that, with this kind of materials, with this kind of energy supply, we can build a machine that can do this. And they are allowed to critique you, and they ask questions, and you refine calculations. And only then these projects are funded. I would say that in medicine, projects are funded without this because the need is huge. I mean, the society requires this solution so much that it doesn't care if we understand what we are doing or not. It just makes us pushing, because if we don't do that, there will be no solution. What I'm trying to tell you is that this leads, of course, to what probably is this inefficiency in drug discovery, because drug discovery is extremely expensive, but the success rate is also very small. I mean, in aerospace projects, you don't have that level of success, which means that there is something fundamentally different in aerospace and biology. Of course, these are different sciences, but I think that the amount of proof that you are required to provide upfront is very different. So for that, you have to infuse modeling and theories into the science, because what these theories do in physics, I think few people recognize that theories allow not to do most of the experiments in physics. When a student comes out with a new theory of relativity, just by doing a few calculations, his theory could be refuted without doing any experiment. So unfortunately, in medical sciences and in aging biology, we are not yet there. So we always need to do the experiment to find out. And this, to me, is a source of inefficiency. So I'm sorry for maybe deviating on this, but I mean, really, the efficiency, it's like in Deutsch book of the beginning of infinity, where David Deutsch discusses why technological process started in Europe. Probably one of the most important idea is that people developed a way to check their new theories against the existing theories in such a way that most of the theories do not deserve to be tested. So that's the important part. So, well, I'm coming from the field where there is, I hope, a good understanding of what theory is and what kind of theories are. So I believe that we must build aging phenomenology. So the minimalistic mathematical model of aging without microscopic details, this kind of statistical pan-animals model, like standard model. And then, of course, for every particular animal, we have to build a specific theory that explains how aging and disease occur in that particular animal. We should be able to do it with data, because humans are now the best studied animals on Earth. We have 500 million people with electronic medical records now. More than 10 million people are genotyped, right? So we have lots of data. And when we have so much data, we really have to put modeling in place so that we can actually start doing discovery on human aging biology from human data and push them into clinical trials. So that's actually the proposition that we are pushing. Get an accepted model, the minimal model of aging across species. Why across species? Because it has to work across human to naked mole rat axis, right? I mean, that's the minimum. And then try to put what we know about aging biology and specific animals onto this kind of standard model and see what is the diversity of control of aging in nature, which things are universal. And because studying lifespan is not very interesting, right? From what we have just discussed today, I mean, what is lifespan? Lifespan is probability of having disease, probability to survive disease. Lifespan is so complex thing that it's very hard to see what is aging there, what is the prowess of the modern medicine, what is your social status and everything else, right? The access to drugs and things like that. So my punch is really here. So first of all, we believe that we provide this kind of minimalistic model, which I hope will be accepted more in the future. And then by kind of joint digestion of this molecule of this model, we should arrive to practical conclusions. Like if I analyze my model correctly, which is a big if, right? Because the model is bigger than the author all the time. But if the conclusion would be that the analysis was right or mostly right, then indeed we should have a program somewhere. I mean, we have all of the hallmarks of aging funded already, right? Let's make a small corner, a small sandbox for people who will try to attack hallmarks of aging in a statistical way with a few technological solutions and see how it works out. And then use this model to carve this kind of target and approach spaces that are not yet covered by the ongoing drug discovery project. And then it will be not so important who is right. It just will put a little bit more system.
It's very interesting. I mean, the development then is that people who want us to think in terms of the hallmarks of aging paradigm say that, look, this is much more fundamental and important than looking at each specific disease paradigm. But you're saying, okay, we need to go even deeper than
unfortunately
below the hallmarks.
Yeah, because unfortunately 15 hallmarks of aging is not a world constant. I cannot open up a book and say that speed of light is this and number of hallmarks of aging is that. So it's too reductionistic in a way. So complex systems don't like to do that. It's more like, it's like in physics there has been all this discussion. It's like, what is the world? Is it a clockwork or kind of emergent mess like evolution and the market? So I think that when you go with hallmarks of aging, quantified, separated into, in kind of diagrams, this is very human in a way. It's not like complex systems operate. It's really trying to explain complex biology in a clockwork mechanism approach. So normally what you see in this emergent messy systems like economy or biology is something different when all the agents interact, solve their internal problems. There is no cell that cares about any hallmark of aging in your body, or there is no any molecule that cares about any hallmark of aging in your body. And still somehow the collective behavior, it's like in a good society when the rules are established, no matter what the particular people are doing, the society is doing something. And the goal of science here is to understand these rules or the effect of those rules. Because if you want to control it, you have to find mechanisms that are controlling and enforcing those rules, not the individual constituents of those systems. And normally you get complex behavior with very few rules. That's the science of 20th century physics. And uncovering this minimum vocabulary of rules and establishing systems that are enforcing them in complex systems is a very powerful approach to inject microscopic behavior without even caring what these particular molecules are doing.
I'm quite curious about your Eureka moment, or when you first came to these ideas, and how did you go from physics to being interested in aging?
Well, I was always interested in biology. I just didn't see kind of a problem of that that matches what I've been studying before. But indeed, my switch occurred roughly at the time when the naked mole rat biology was published, because I almost immediately had the idea that In physics, there's always this discussion. To get complex behavior, you can do it, as I said, in two ways. You can get some kind of fine-tuning when you have like many processes adjusted to in certain ways so that the complex behavior occurs. Or there are just a few things that enforce simple rules, and you end up with a new behavior. This is called emergence. And in physics, you are used to superconductivity, superfluidity, where certain property disappears. It's not becoming small, but I mean, it just disappears, like conductivity or viscosity of a superfluid liquid under certain conditions. So I was thinking there could be a model where aging could disappear in a phase transition in a sufficiently strong system. And surprisingly, such a model exists. And when I realized that, I started switching because I started developing this. Because once again, this idea of phase transitions that are controlling behavior of complex systems in such a way that certain property disappears, it's very powerful in physics, and I saw evidence that this may work for aging, and that's how all these theories that we're developing were actually born. So we published in 2015 a preprint that we have never published in a journal. So it's still a preprint, but essentially it's a blueprint for our work at Gero. We essentially said that whenever nature wants to extend lifespan of somebody, it does it by phase transition. And then, I mean, it was a simple idea, but there was, of course, a learning curve, which I am not sure I have completely, I have completed. But there were surprises on the way. So I was thinking that everything is simple. It's not. But this 2015 preprint is actually a blueprint of everything that we're doing in aging. We're just trying to extend this theory to make sure that we understand mice, humans, and naked mole rats in the same picture, and being able to identify from measurements the parameters of those models in all three species in such a way that we know at least what to target, or at least how to measure, so that at least we would know what success looks like, right? And then everything else is, we're working with the best people in academia, people like Andrei Gutkov, Brian Kennedy, Jan Gruber, and everything else. That probably reflects to your initial questions, because the learning curve there is infinite, right? I mean, there is no way to make a biologist out of me. This is impossible. But we are building a network of people who are helping us actually test experimentally our predictions and hopefully solve the problem together.
So your great inspiration was a mole rat.
Yes, I have to say that the naked mole example forced me thinking that aging could disappear in the phase transition. And then if it's true, it could be that I have some unfair advantage to the people in the field, if it's true.
Yeah, but so more than that, you just didn't come up academically with this idea, but you founded your company based on this idea, right?
Well, it's always hard to analyze your past in the retrospect, but yes, I think I'm kind of libertarianishly inclined. I couldn't see that this then, but look at what happens now. The thermonuclear fusion is made by startups. SpaceX disrupted NASA. Quantum computers are built in startups and not in academia. Academia cannot even fund the technology on the levels that are available to big tech or startups that this big tech eventually acquires. So my intuition at that time was that it's very hard to do cross-disciplinary science in academia. In academia, it pays off if you do what you do, at least before you get tenure, right? So you really have to kind of super focus, get your kind of job security, and then maybe start talking to other people. And second, the intuition was that probably we live in this kind of bifurcation time when whenever a technology is possible, it gets funded in billions of dollars quickly. Like, everything is burned out around, everything is tried, and then either the solution exists or no. But it could be that deep tech emerged over the last 20 years, roughly at the time when I was switched. And I think that maybe it's a good way because science was funded by businessmen and celebrities of the times. Only in 20th century, I think, when science due to nuclear weapons became too important for the governments started funding science. But I'm not sure that governments are good in finding science. We don't have like exceptionally good evidence for that. So I would think that in the future, government should, of course, help, seek old and everyone else, maybe do defense and maybe do super fundamental science. But I think everything that can be turned into technology will be probably translated into products a lot faster with deep tech model. And I hope that I, switched to the right side of the history when I did it.
So you collected a team around you that you thought could believe in this paradigm.
Yes, and what most important that we also collected a number of investors who were buying in this idea that that look, why should we care about a particular disease if there are animals that do not age at all? And I mean, at least in theory, if there is a running example of this, there could be a technological solution, right? So, I mean, the idea has transformed a lot of times. As I said, the learning curve is still immense, right? I mean, every time we come up with solutions that somehow work, but not yet the level of the solution that we want eventually. So I mean, we were trying not to infuse entropy into aging for almost 10 years. So we published Entropy and Age Irreversibility in 2022. So, I mean, it took also, it's also a cultural problem, right? Because when you come to the field where everyone believes that everything is reversible, you operate in that field, you learn from them. So it takes time even for you to understand, to change. So I think we experienced a paradigm shift in 2022. We actually developed a solution against one of the hallmarks of aging. Hopefully it will be in the news pretty soon, commercially. But life is more inventive than our ideas about it, and that's why we're now going into this effective temperature and entropy generation to find even better solutions.
Is that something you've discussed openly, the solution to one of the hallmarks of aging?
We haven't yet discussed, so it will be it will be announced soon.
Sounds exciting.
Because it's totally commercial.
Yeah. But yeah, so that might also be. I mean, what I was going for before was that you have these different programs. You have the studies being done on partial reprogramming, for example. You have the senolytic field. You have all these kinds of different interventions now against the different hallmarks of aging. So, I mean, just curious, how do you see interventions? How do you when you want to slow down my aging at some point in the future? What type of intervention would I be using?
Well, once again, it's like in kind of umbrella terms. We believe that hallmarks of aging together generate chronic diseases, and that's why the best drugs against particular hallmarks of aging will be drugs against chronic disease. I think you can see this trajectory with BioAge. They started as a longevity-focused company, but remember some part in our conversation when I said to you that diabetes type 2 robs you 10 years of life. So if you want, and quite a lot of people are diabetic, so if you want to extend life by quite a lot and many people, solution for diabetes is a great start. So that's why I think we now see this hype in metabolic health, and lots of longevity companies are also pivoting to metabolic health.
Yeah.
Meaning that what I think will happen in 5 years, let's say from now, that most of the longevity companies will become biotechs against age-related diseases with some specialization, like bioagent to the metabolic health. And this will call actually for other solutions, right? Because people will see that the hallmarks of aging concept actually created a bunch of great drugs against age-related diseases, but not really aging itself.
Yeah.
So we are trying to see this coming, and I mean we're proactively kind of informing people about that, and well, this is the strategy. This is the strategy is to start developing now, because as I said, the biotech development times are so ridiculous that you have to know your solution if you feel like you have a chance to develop it in 10 years.
How is artificial intelligence and all what is happening with AI right now helping you accelerate your work?
Well, on many levels, because our work depends on the analysis of human data, because your models, I mean, models are useless if you cannot actually match them with experiments in numbers. So that's why we use millions, more than 10 million electronic medical records, for example, in humans to understand the relation of aging, diseases among themselves, factors that are controlling the rate of aging, with your genetics and everything else. And the amount of such data is just ridiculous if you want to use, linear algebra to understand that. So, and by the way, there are not too many people who know linear algebra anymore, and there are lots of people who know data science, right? So I think that certain algorithms in generative AI over the last 20 years, some of them are among once in a quarter of a century scientific advancements, right? I mean, the idea of generative AI, for example, language processing is something totally different, but the generative AI to feed data on particular models, that's something that we use a lot. So I think that the mere existing of Gero and our ability to continue our approach is not because we're strange or smart. I think if I look at works by Streller, for example, in the 60s, I see that the guys understood no less than we. But at his time, he didn't have enough data to actually make any use of that. So I think that what happens now is that we're just taking the torch from these guys. I mean, models that you cannot translate into therapeutics, even academically, are not very well. By the way, Streller, when he published his Streller and Milvan published their paper, I learned from some people who knew him. He actually understood that aging is entropic and gave up on aging.
Right.
So whenever I think about it, I see that he was a super smart guy, and why am I not giving up, right? Because I'm kind of I'm supporting this argument now with more data and everything else, but in the most important part, we're just proving that he was correct. And I think the difference is that now we have tools that he couldn't use, and we have data that he couldn't use. And well, that doesn't let me sleep well at nights. But yes, I hope that in 2 generations, we have now a tool set that will eventually allow us to solve the problem instead of giving up. Yeah, it's a Streller moment. I think that the way we infused the second law into Geroscience, I would call this a Streller moment in biology of aging.
Do other scientists who are following other paradigms, like partial reprogramming, for example, where they talk a lot about turning back the clock, how do they react to you?
Well, you could see it from our discussion with Aubrey. So people are trying to put arguments. And as I said, I'm not suggesting that at small doses, the interventions have the right sign, meaning that at small doses and for small effects, they will be beneficial. I think they will be super beneficial for particular chronic diseases, because this idea of cell reprogramming would be, I think, super powerful when you want to restore pancreatic cells for diabetic patients, for example, and things like that. So I'm giving them credit, for people that are developing the correct tools that could be very powerful, because they are developing a new layer of biological interventions other than biologics, small molecules. There is no scenario where this biology and technology will not be beneficial for a lot of people. What I'm just trying to say that whenever they will try to escalate the dose, they will reach the limit pretty quickly. And that means that either we have 2 options. We can either wait for this, and for example, I could be wrong, or the alternative is to work on alternative solutions. And that's what we are providing, because once again, nobody knows the future. And being a physicist, being a PhD in theoretical physics doesn't protect you from being wrong. What I'm just trying to tell you is that I mean, there are lots of other systems where life turned out to be a little bit more complicated. And what we're suggesting are testable stuff. And I think it's irresponsible to just think about it. It almost looks like if there was no cellular reprogramming, the Geroscience would get a hit. Right? I mean, the cellular reprogramming was almost like a last resort solution, you know, the last solution that they kind of pulled up when like almost everything else was not performing like exceptionally well. Right? I mean, it's no disrespect, but it really looks like we rely on the next shiny thing. It's right. I mean, think about it. What if Yamanaka factors were not discovered? What aging biology would be discussing today?
Yeah, it would be more dire, that's for sure.
Yeah. So to me, this is always a bad sign when your newest shiny thing is the solution to your problems. In a way, you can consider what we are proposing as a hedge, because it looks like in some other systems life is a little bit more complicated. We are generating testable hypotheses, interventions that will affect aging in some ways. And I think we don't need for other approaches to show their effect or limited effect before we start trying new. It's like in clinical trials, you keep developing your backup molecule before phase 2 is successful. You cannot just give up on everything else and say, look, we have cellular reprogramming, problem solved.
So there's this competition on pushing forward AI research in the US. Do you think any of that money can come to your approach, because it combines, of course, a lot AI with research and aging? Is that possible?
Well, I think it's super possible. There has been a recent example by Sam Altman's efforts to produce a language model that was optimizing some of these Yamanaka-like factors with some good results. So I think that well, sometimes I feel like what we're trying to do, we're trying to solve the problem the old way, and of course the people in AI are trying to solve the problem in a new way, saying that just give these systems lots of data and they will come up with solutions. So at this time, I think those people are arrogant and they think that they will solve it on their own. We think that we are learning from them and we acquiring AI technology that are required to solving for our pipelines. I don't know. I mean, they have lots of smart people, and some of them, I mean, quite a lot of them are both mathematically and physically educated. So I think they will see what we see pretty soon. What they will do from that, I don't know. But well, I think the competition will grow. I do think that when people with mathematics, engineering, data science background come, they bring this culture of asking for the effect size. And once people start doing that, there will be demand for projects that can, if not guarantee, but at least promise
I'm
strong
thinking
interventions.
that the cultural influence could go the other way too, that they could become more interested in geroscience and
Yeah,
in
I hope
preventing
so.
aging.
Yeah, I hope so. So we see that quite some of them are, well, we over the last few weeks, we had these examples like from few companies, the CEOs were talking about using AI to solve cancer, aging, and everything else. Look, I think this is a very welcome development because quite a lot of their tools are becoming open source very quickly, and there is lots of competition there between them, which means that projects like us can use things that they are developing, maybe with a 2 years lag, but who cares? I mean, 2 years more, those solutions were not present at all. Well, of course, there is a lot of competition, so it's a little bit worrying. But at the same time, if more people start seeing what we see, there will be more resources coming to the particular type of solutions that we're developing. Even more than 10 years after switching, I think that biology, and specifically biology of aging, is a great field of study with immense practical impact. So in no other world, I would be doing something else. And I think it's a huge field where many more people with diverse backgrounds can join. I think 21st century will be the biology century, and I think it's not too late to participate. So more people should come and help.
So, Peter, shall we ask our book question at this point, or?
Yeah, I mean, it was. I think it's so thought-provoking what you're doing and interesting. So hopefully we'll get to have you get back here and we can discuss it more in the future. But yeah, we always ask our guests about 3 books that they want to recommend. It could be any type of book.
Well, I can just pick up from kind of my latest reading. So there was a book, I think it's called Physicist and the General, about Oppenheimer Manhattan Project and the interaction of the physicist CEO or CTO with the general from the engineering, from the military engineers, who was actually a CEO. And to me, this book is super cool because this develops into example of a mega project, how it is executed, what were the challenges, what are the personal communication issues and everything else. So I learned from there is that the CEO has to be well connected, as usual. CTO should be able, but CEO should be well connected. Another book I wrote, a biography of Columbus. I think any would do. This is also very interesting because, to my taste, Columbus was one of the first examples of venture-backed projects at the time when Y Combinator safe was not yet present on the internet. So the guys agreed on certain terms. He discovered something. The milestones were not achieved. The crown was changing the conditions. So the startup life now back in a few hundred years ago. So I think it's very kind of interesting to read and reflect how we end up with laws and procedures in deep tech that are present now. And still there is another book. I think many people recommend it. There is a tough author, which is David Deutsch, because whenever I think why a physicist has a right to tell anything in any other field, I try to find answers in David Deutsch, The Beginning of Infinity, where, I mean, this book is exceptional because first, this is the best known, I think, example where the person tries to build all our ideas about the universe from the examples that you could follow. Right? I mean, it's kind of reverse engineered science. And second, of course, the question, what is science? Why some sciences are more efficient than the others? What is the good explanation? Is the goal of science just to describe the data? Is there a merit in explaining? Because as you understand, if I talk about theories of aging, I'm kind of dropping at that age, saying that, well, AI gives you the way to describe, but the actual progress starts when we're able to explain. And they switch from the ancient science of description, right, horoscopes and everything else, to explaining was actually the phase transitions that generate technological revolution. And I think this technological revolution is going on and diffusing in other sciences. And that's why I think everyone who is a practitioner in the field, I think it's kind of very super important to read and understand what was that something strange that happened in Europe and made the technological revolution ticking.
Those were some amazing sounding titles. Thank you very much. And thank you for your patience and your great skill of explaining these concepts for us. Thank you.
Doing my best. Thank you very much.